the contracting process and hold while the protest is in place. We have no control over that protest element. That is obviously within the unrequited proposal of the unsuccessful contractor. So we did have to consider that as well.
This is the last question, Mr. Chair.
I follow up.
And I gather in your position, you're looking at justification that's come forth from the agency and evaluating whether it's valid or whether, and you ask specific questions. But to what extent do you know whether the agency went out and looked at other entities or firms that could provide these services? I gather you're looking at it purely from a compliance perspective, and please correct me if I'm mistaken.
I look at it broader than that. I do not know particularly if there was a market analysis done directly outside, but I do know by interview process of the folks who were making the decision and putting forth the agency putting forth the contractor for the agency to be successful, that justification had evaluated other firms.
And do you ever deny requests that come through the agency for these types of contracts? I mean, do you generally, once the justification comes in, sign off on it? Or are there times when you say this doesn't look right, it doesn't meet the smell test, let's go back?
Have I ever turned away any of the justification?
Within the last, say, 18 months?
Since that comprises my entire time with the agency, sir, yes, sir, I have.
Thank you, sir.
Mr. Payne, did you have additional comments on?
Thank you, Mr. Chair. Senator McKessick, just to respond briefly, it is my understanding that our CFO did research other firms. Just by way of my background, I am an attorney, as you know. I spent 25 years as senior counsel with 3 different health insurers. I can tell you that in my experience, I am not aware of another firm that provides the same level of turnaround expertise in the financial area and broader, specific to DMA, as Alvarez and Marsal.
Representative Martin.
Thank you, Mr. Chair. And this question is for Secretary Bosch, and it is more at a high-level general question. So if you're here this afternoon, if you prefer to defer it, I think it would fall into the next 2 categories as well, but I'm happy to ask it now if you have preference. Thank you. The presentations today have been very interesting, and a lot of what you're talking about appears to be operational and organizational efficiency. And I'm interested in your comments on how you see this tying into another topic we've talked a lot about, which is Medicaid reform. As I've listened to all these things, this is not Medicaid reform, and I want to make sure to clarify that this is not Medicaid reform, although if our current system was working optimally, then that perhaps is part of Medicaid reform, because so we can identify those areas where we really need to reform, and we are starting at a good baseline. But what are your thoughts on how important this efficiency work is for that next component?
We all know at the biggest level, the path that we were on in North Carolina, Representative, was not sustainable. We couldn't get it right, we couldn't provide the right service to the right person and have any clue how much this was all going to cost. So the path we were on, especially at the same time with the environment of the changing healthcare system from the federal government, for the department was something that absolutely the work came to a screeching halt. There were not enough folks to do the correct job in the correct way with the changes coming towards us. On top of that, with the change of IT. So where we have gone for the 19 months and where we are going for the 19 months is to build a very firm foundation organizationally for the department that meets first and foremost current needs, and our current needs are to be responsible towards you, towards the taxpayers, towards the federal government, to everyone who we report to the citizens of the state that we provide all the service to. So that's our current obligation. In order to fulfill our current obligation, We had an emergency in the department. We didn't have enough people and the right people, and we couldn't get it right with the information, the data, and the numbers of the budget and everything else that you're asking us. That was an emergency. We have obligations to work every day to produce a product. The product is in the form of help or information or reports or what our daily work we could not produce. So the only way to produce our work in an emergency situation is to ask for outside help for people who are able to provide that. The decision was made with our partners here at the table. Now, where we are going with first succeeding in managing our daily work. We managed on, you will hear after lunch, closing out the year in the best possible place for the department and the Division of Medicaid in the last 5 years. We are becoming much stronger, much more reliable, and so that's the present. Now going forward, where we are going forward is your question. Once we have this fundamental organizational structure with the right organizational structure and the right talent, we will be able to adjust to whether industry or government needs. We will be able to do that. So this has nothing, our need for the present and our vision for the future has to provide our ability to adjust to the unknown. And the unknown is where the healthcare industry will be in 5 to 10 years from now, and where we as a department and the state have to line up within the next few years. So the answer in short to your question is, we had an emergency, we had to figure out how to get our daily work done. We succeeded in that. We're kind of in the middle of our path of our organizational firm structure. From that, we are building up, and we are building in a direction that will allow us to then aggressively move towards your other point, Medicaid reform. Now, we have simultaneously, as everyone knows, been working for the last 19 months on our Medicaid reform, which was before you and was unanimously bipartisan voted out of the House, as you are aware of. And we are still, right now, waiting for future collaboration with the General Assembly to continue to move forward for the best model for the state, which we still hold firmly that it is the model we presented. But that's Medicaid reform, which is very different from reorganizational need after 40 years inside of the department. And we are doing both those paths simultaneously.
Senator Palmer?
Thank you, Mr. Chairman, and I think this is for Mr. Oglesby. I'm not an attorney, and as you talked about the kinds of contract, whether it's sole source or personal service, my question is, what's in the contract, or is it within your purview to determine if we're getting what we're contracting for? Is there a point in the contract for it to be reviewed so that we will know that the public is getting, or the department is getting what we contract for under whichever kind of contract?
I'll take the first stab at that, Senator, but what we have here is a different kind of collaboration that is very specifically a day-to-day, week-by-week activity and building, so that a hard deliverable at the end, or a specified statement of deliverable, which I have the scopes of work with me, and we could read those into the minutes, but I don't think that would serve the purpose very well. What you really have is a correspondence between the agency itself and the contractor as they put forward the suggestions for review and collaboration, and then began to implement those that are decided upon in a collaborative basis. It's more like what we talked about earlier, the report card post and the report card during perhaps even this committee and Dr. Wynn's presentation, what has been done so far and those continuing questions. They answer what is being delivered, what will be delivered, and the committee has a responsive nature of seeing what the goals are. That's how we wrote the contract, and that is toward the specified structure. And that's the way the scope of work, which I've shared with members of the council to the committee, That's where the scope of work is written.
Thank you.
Any additional questions for members at this time? Senator McKissick has another one.
Yeah, just, Dr. Oglesby, if we could. I'm just curious, and you may know the answer to this, or Dr. Glenn, but I assume we had a team of people that were working on this project. How large was that team, and in terms of senior management, what was the typical hourly rate that we were paying for the services that they were providing? And I'm assuming that the individuals are keeping a tabulation of the hours of work that are going in. And I don't know if Dr. Glenn would be the one to answer that question, or I'm just trying to get a sense of how much we're paying at the state for these unique expertise that we're being provided. And if hourly rate is the best way I know of kind of disaggregating that.
Senator, yes, we do have an hourly rate structure, and I'd have to look at what the general blended rate is. It's at a resource level, and I will highlight that we've made additional experts available up and beyond what we have, what we had originally been contracted for, to ensure the success of the activities that are done day to day. So if appropriate, I'd be happy to supply what that blended rate structure is.
I'd like not only the blended rate, but, what the top people are actually getting paid. I mean, if it translates into $800 an hour, I don't know what it is, but.
It does not translate into
but I'd certainly like to know, because we're talking about quite a substantial bill to be accumulated within roughly about an 8-month period. And I'm not sure how many people are actually a part of this particular project or engagement. How soon do you think you could provide us with that information?
We can provide that information this week.
Thank you.
If you would provide that to the chairs or the staff of the committee, and we'll make sure that it gets out to the membership. And did Senator Tartt, did I see your hand on the? Okay, all right. Mr. Oglesby, if you will as well, and I don't think I mentioned this yet, with your written remarks, if you don't mind, please submit those to the clerk as well, since we didn't have a presentation, so that they'll have your remarks for the record. Are there any additional questions at this time before we break for lunch? If not, we'll come back at 12:45 to continue.
Okay.